Welcome back to BNC Live. I'm Tishani Wedlow. Louisiana's health department has revoked the licenses of 7 nursing homes that sent residents to a warehouse to shelter during Hurricane Ida. The department says it was unsafe and unsanitary. According to state health officials, 7 of the residents sheltered at that warehouse died. Now, several family members have filed a class action lawsuit. Brian Todd reports.
The horrific accounts keep pouring in of overcrowded conditions inside this warehouse, where some 850 elderly patients were taken from nursing homes around Louisiana to ride out Hurricane Ida.
It was just horrible. I just don't want to think about it, truthfully.
So you watched people die there?
Yeah, at least 4 of them that I know of.
Bridges Edmonds, an elderly woman evacuated to this warehouse in Independence, Louisiana from a nursing home, spoke to CNN affiliate WVUE. Edmonds' sister gives her own jarring description of conditions inside.
They didn't have adequate staff. She said that the bathrooms were overflowing. People couldn't go to the bathroom, and people were using the corners of the warehouse to go to the bathroom.
This man has asked to be changed since early in the morning to be changed, and here we go, it's 4:21, and still yet he's yet to be changed.
Video filmed by an anonymous person inside, given to WVUE, shows crowded conditions. A man told that station they were, quote, packed in like sardines.
We were placed on beds that weren't even beds. There was just mattresses on the floor, and there were insects crawling all over the place. There were roaches, spiders, ants crawling all over the place. The heat in there was just not good.
We interviewed Independence Police Chief Frank Edwards, who told us his officers tried to help people at the warehouse before, during, and after the storm.
During the storm, the wind was blowing hard. It was blowing rain. Water got into the facility, not from rising water, but from water going sideways and under the doors. So the floors were wet.
At least 7 nursing home residents died after being evacuated to this warehouse. State officials say 5 of them are considered storm-related deaths. The Louisiana Department of Health has revoked the licenses of all 7 nursing homes they came from, which are all owned by the same person, Bob Dean, who CNN has confirmed also owns the warehouse. 2 nurses who tended to patients at the warehouse spoke to CNN. Nurse Natalie Henderson saying the conditions were, quote, nasty, very unsanitary. She also spoke to CBS.
The whole place is reeking of urine and feces. On top of them trying to eat, they're begging for water.
Another anonymous nurse tells CNN, quote, they told us we were going to sister facilities out of town. They at no time told us they were going to a warehouse.
Oh, I'm furious right now. Somebody needs to be held accountable, and the state needs to do something to control this during the hurricane. The hurricanes are not new to us.
The class action lawsuit claims the defendants intentionally misrepresented the actual evacuation plan, choosing not to inform family members of the planned evacuation or tell them where the residents were being taken. The plaintiffs are demanding a trial by jury in this case. All right, joining us now is Dr. Corey Hebert. Dr. Hebert, I mean, you heard the conditions that some of our most vulnerable people in society at an age we should be protecting them. I mean, talk about the impacts on folks at that age. I mean, the health ailments that they had and the impact of the conditions there.
Yeah, well, first of all, I would just like to offer my condolences to anyone who lost their life in that facility. You know, I am ultimately responsible for my patients as a physician, and the doctors that were in charge of that facility, including the owner, they have a lot of explaining to do. Now, I will tell you, I'm intimately associated with all of those facilities. I know them very, very well. I actually volunteered time to go there and read to the folks and give all types of health lectures at those facilities. And I'm telling you, this was a very heinous situation that was, I can't even wrap my mind around how they intended to put 350 people into this warehouse, let alone 800 people being in there. I mean, with the heat of a hurricane, post-hurricane rather, you know, if you haven't been through this in a hurricane down in New Orleans, it's hard to explain. But what we do know, and that we learned from Hurricane Katrina, is that this should not have happened, because everything that was done medically at all the hospitals, all the other medical facilities, we learned so much from Hurricane Katrina that things went very smoothly. But this particular situation, someone had no foresight, and I want this to be a clarion call to everyone out there who has a family member or a friend in a nursing home, because this can happen to you. You need to make sure that you look at the look at the policies and procedures of emergency evacuation for every person that you have in your family that's in a nursing home, because these are the things that happen when everybody gets all in an emergency situation, everybody gets all flustered. But we need to be preparing for this now, because once you have heat for this this very vulnerable population, heat stroke is it's very easy to happen when you don't have enough air conditioning and you don't have enough water. You have cramped conditions. You're not being taken care of. You're not being given your appropriate medicine. Power goes out. You don't have your refrigerated insulin. You don't have oxygen. All these things happen in a hurricane, which we knew after Hurricane Katrina. So that's what makes this such a heinous situation.
Absolutely. And the fact that, according to that report that we watched, there was no proper facility for them to relieve themselves. And they're still in the same space eating. They were talking about unsanitary conditions, roaches. I mean, for someone that has breathing issues, Dr. Hebert, I mean, combine all that on top of heat and the stuffy conditions and the unsanitary conditions as well. What can I do?
Yeah. Well, a couple of things that we really need to remember is that we got away from taking care of patients in wards a long time ago. It's just not appropriate to have people in an open facility where there's no partition between them. That is just inappropriate. You cannot put people in a warehouse. A warehouse is for merchandise, not people, which was the first mistake. But, you know, I will tell you that I was doing a lecture, and I remember one of our local television anchor women, Margaret Orr, she mentioned that there was a hurricane possibly in the Gulf. And this was on a Thursday. And myself and the other folks that were on the news that night, we looked at each other like, a hurricane? So there was not a lot of time to prepare for this, because on Thursday when it was coming and everything had to be basically done on Saturday. But that's not an excuse, because these programs and these evacuation plans, this was a mandatory thing that had to be filed by the licensed facilities to the state every year to be able to maintain licensure. So that's what they're going to try to say, oh, it happened so fast. But you're not supposed to have it happening too fast, because you're supposed to have planned for this every year since Hurricane Katrina 16 years ago. So that's going to be their defense, but it's indefensible what happened.
Dr. Hebert, the Centers for Medicare and Medicaid reporting more than 615,000 confirmed COVID cases among nursing home residents, with 134,000 of them dying. Considering what happened in Louisiana, what we're just talking about right now, are we failing our elderly at a time when they need us the most? I mean, we're in the middle of a pandemic. We're also in the middle of recovering from storm damage. And a lot of these folks can't have access to their family because of the pandemic.
Yeah, we are, and what I will say is that we did put in plans to make sure that they got vaccinated first, and I think that was really, really important after they started having these pockets of death when this pandemic first started. So I think that we did a really good thing as a country to make sure that they got the vaccines first. They will be getting the boosters first. That is really important. But at the same time, you know, these folks are the people that we're standing on their shoulders and everything that we do, and it's really it's abhorrent when I think about how they generally are being treated. And I will throw this out there, okay? You know, when you have someone in a nursing home and you have a hurricane coming, I think it's important that you need to be, as the person that is their primary relative, to be very aggressive about trying to get those people out as a citizen. You know, if my mother or my sister or my brother, if I have the means to get my family member out of a nursing home before a hurricane hits, I don't really want them to be under the guise of a state situation when there's a hurricane coming. But most people that are in nursing homes don't have that type of familial support. So that's why if you have someone in a nursing home right now, you need to be very aggressive about trying to figure out what is the next plan, because the people in New York didn't think it was going to happen to them, and Ida went straight up up there and did the same thing up there. New Jersey, the same thing. So, there's earthquakes in in California, tornadoes through the Midwest. You have to be, you never know when these things are going to happen. So for our most fragile community, meaning our older folks, whether they're in a nursing home or not, we need to be more responsible about trying to take care of them when times get very tough, because they've taken care of us when we were much younger, and we kind of owe that to them.
Absolutely. As my grandfather would say, once a man, twice a child.